32 COVID-19 deaths in the past 24 hours. That's the latest coming from the Ministry of Health. Among the latest fatalities are 18 men and 14 women. 16 people among those are reported to have had multiple comorbidities, including diabetes, hypertension, and kidney disease. The Health Ministry also confirmed 706 new cases of the virus, taking this country's active cases to 14,583. 80 people have been discharged from public health facilities, while 524 remain at hospital and are being treated for the virus.
In more news, testing for COVID-19 would be extended to other passengers who were on the flight with this country's only Omicron case, if the 14 persons currently in quarantine test positive for the virus. Confirmation of this comes from Chief Medical Officer Dr. Roshan Parasram, who says the 14 in quarantine have not yet shown any signs or symptoms. Sinilala has more.
Dr. Roshan Parasram says there's no change so far in the status of the 14 persons who were quarantined after coming into contact with this country's only Omicron case so far. On Monday, Health Minister Terence Dialsingh confirmed that the case came via a flight from New York, adding that 14 persons who were on the flight have been quarantined as per protocol. Dr. Parasram says these passengers would again be tested in the next week and would be released from quarantine once no symptoms arise.
The condition is the same. There would be some testing on day 12 or thereabouts, and once that testing is negative, of course, then those persons will be released from quarantine.
However, Dr. Parasram says testing for other passengers on the flight could be conducted if any of those persons in quarantine present with any symptoms.
But we do have a listing of the persons that were aboard the aircraft, which lies with Port Health, and in the event that a large number of the 14 become positive, we'll spread our net a little wider and see and go from there. But chances are it will be contained within that group.
The CMO, though, says the risk is low since mask wearing would have been mandatory on an aircraft. He adds that the discharge criteria for the Omicron variant is also similar to what is currently in place for the Delta variant of concern.
So before Delta became community spread, if you could remember, we would have gone to a process where we have a double negative PCR result before you're released, discharged. So that is the situation we are at with this new variant of concern. If patients come into us through repatriation flights, they go straight to a step-down facility. They're not allowed to go home.
As of Wednesday, 77 countries had already detected Omicron variant, with more countries bracing for what scientists believe is the most transmissible variant of concern to date. Sonolala, TTT News.
In more news, as of Wednesday morning, there were over 200 COVID-19 cases in the various accidents and emergency departments, the highest number this country has ever seen since the beginning of the pandemic. This was confirmed by Chief Medical Officer Dr. Roshan Parasram in his update, reiterating the critical need for citizens to wear their masks and get vaccinated. He warned that although various sectors of the economy has been opened, it is by no means safe since the rate of spread is alarming. Dr. Parasram continued to voice his concern over the possibility of the parallel healthcare system being overwhelmed.
We have this morning 212 cases in our accident and emergency spread across the country. And that number by itself is alarming. It's the highest number we would have had in the A&Es for any given period of time. So it means that the parallel system, as you say, is getting to capacity. Expansion of a system by way of creating beds is one thing, but we have a finite resource in terms of human resources that cannot spread very much further.
Meanwhile, Health Minister Terence Dialsingh urged the population to get their booster shots, and even in the lead up to Christmas.
Because some of the feedback we are getting that people who are due for their boosters, they are citing Christmas and Christmas shopping and Christmas activities as a reason not to get their boosters. I strongly advise against that. As a matter of fact, the opposite is true.
The minister said 89%, which equates to 6,749 persons out of 7,626 in the parallel healthcare system, were unvaccinated, citing the need for the vaccine to help save lives.